it's Katie from MobaCare. So as I'm sure you're aware, it's cold season. I've already had a couple of sick kids in my house and a ton of sick patients. So I wanted to take a few minutes to talk about upper respiratory infections and what you can do to treat your symptoms. First, let's talk a little bit about the common cold, which is the most frequent acute illness in the United States. There are over 200 different viruses that can cause a cold, and they are all very common and very contagious. Colds are spread by hand-to-hand contact. So someone blows his nose, doesn't wash his hand, shakes your hand, you're done. Colds can also spread by droplets of virus in the air, which is why we always tell our kids to cover their cough. Studies have shown that the virus is most contagious on the second or third day of symptoms, but people can spread it for up to 2 weeks, even when they don't have symptoms. So it's really hard to avoid catching a cold. On average, most adults will get 2 to 3 colds a year. Preschool kids can get 5 to 7. I know, those poor preschool teachers, right? The most common symptoms of a cold are nasal congestion and runny nose. The discharge or snot can range from clear to green. So a lot of people think that green snot means that it's a bacterial infection. That's not actually true. I repeat, green snot does not equal bacterial. Other symptoms of a cold include a sore or scratchy throat, cough, facial pain or pressure. One of my kids just got over a cold and his biggest complaint was that his head felt heavy, which is very common. Fever is not uncommon in people with a cold. However, it is more likely in kids than adults, but adults can get a fever with a cold too. Generally, a cold is self-limited, so that means it'll go away without any treatment at all. Usually, symptoms will last anywhere from 3 to 10 days, but they can last up to 2 weeks, especially in smokers. Because a cold is caused by a virus, antibiotics don't help. I'm sure you've all heard about antibiotic resistance and how taking an antibiotic when it's not necessary isn't good. You just gotta let it run its course. That doesn't mean that you have to be miserable, though. There are a ton of medications to help treat your symptoms while the virus works its way out of your body. I actually took a little trip to Rite Aid down the cold and flu aisle to show you all of the available options. So I am about to go into Rite Aid. So if antibiotics aren't the answer to when you have an upper respiratory infection, what can you do? There are hundreds of over-the-counter medications. How do you know what to pick? How do you know what to use? What's going to help you with your symptoms? We're going to talk about that in this video, and I'm going to go into Rite Aid right now and try to get some video and some pictures of all the available options. As long as they don't kick me out. I don't know how they feel about videotaping in their store, but it should be interesting. So let's go check it out. Now, this is Mucinex. Mucinex is going to be good for thinning phlegm. So if you have a lot of thick drainage in the back of your throat or you're coughing up thick phlegm, Mucinex is going to thin those secretions out. Next up, we have Sudafed. Sudafed is a decongestant. So it's Sudafed or pseudoephedrine is the generic name of this, and they both work the same, whether it's brand name or generic name. Sudafed is going to help with congestion, so that heavy feeling head, nasal stuffiness, that's what Sudafed is going to help you with. You should not take Sudafed if you have high blood pressure, though. So if you're someone who has high blood pressure, no Sudafed for you. Let's talk about cough medicine. So there's several different kinds of cough medicine. Robitussin is a very popular one. Now, Robitussin is a cough suppressant. So that's different than the Mucinex we talked about earlier, which is an expectorant. An expectorant is going to help you expectorate or cough. A cough suppressant is going to suppress those coughs. So Robitussin is a good one. Delsum is another one that happens to be one of my favorites. I don't know why, I just feel like it works really well. But Robitussin, Delsum, those are going to be cough suppressants. We've talked about congestion, we've talked about runny nose, we've talked about cough. Now let's talk about sore throat. How can you treat a sore throat? And in short, the answer are throat lozenges. These are very useful for relieving the symptoms of a sore throat. The other thing that is helpful for sore throat is just simply Motrin, Tylenol. Those are going to help with sore throat as well. But these throat lozenges are really useful for that. So just to wrap up, and please forgive the shaky video from Rite Aid. I was trying to get it on the down low. Anyway, treating the symptoms of a cold. Thick mucus, you're going to want to use Mucinex. For congestion, Sudafed or the generic version will be your best friend. But remember, not if you have high blood pressure. If you have a cough, make sure to use a cough suppressant like Robitussin, Delsum. NyQuil is good for nighttime cough. It will help you suppress that cough and also help you get some sleep, hopefully. And then for sore throat, make sure you're using throat lozenges. Hot tea with honey is also super helpful for a sore throat if you want to go a more natural route. The other thing that helps with sore throat and fever and headache and body aches, Motrin and Tylenol. So make sure that you always have some of that on hand. All of these can help you make it through that upper respiratory infection. It's also super important to slow down, get lots of rest, and I promise you'll be feeling better in no time. If you aren't sure which medication is best for your symptoms, you can always ask. Send me an email or a text, give me a call. As a Movicare member, you have 24/7 access to your NP. That's exactly what I'm here for. I hope you enjoyed this video and are prepared next time you catch a cold. Please remember to like and share it with anyone that might be interested. See you next time.